watching Eye on Ocean County. I'm Christina Seco. Community Medical Center in Toms River is the only hospital in Ocean County to offer a new cutting-edge technology in cancer treatment known as the CyberKnife. Joining me now is Dr. David D'Ambrosio, radiation oncologist and medical director of the CyberKnife program at the J. Philip Sitta Regional Cancer Center. Doctor, thank you for joining us.
Thanks for having me.
Let's talk about this CyberKnife program and this non-surgical cancer treatment. I see you did bring a model for us to demonstrate what it looks like.
So the CyberKnife is a new kind of linear accelerator, which is a machine that uses high-energy X-rays to treat cancer patients. And linear accelerators have been around for many, many years, for 30, 40 years. But the technology has gotten better. And about 10 years ago, the CyberKnife was invented by a neurosurgeon in California. And the advantage of the CyberKnife is that it takes one of these linear accelerator machines and it mounts it onto a robot arm. Now, what that enables us to do is to treat a tumor from many more different angles than we traditionally could, which was only in a single plane. And that now allows us a level of precision that we've never had before. So we're able to give very high doses of radiation to a very small area, and at the same time limit the radiation to the surrounding normal tissues.
Now, this is the machine that you're talking about. So it actually would. Can you show us how it works? Like,
yeah,
it would
sure.
move around the patient. Because
So,
you're saying you're able to get it from other angles.
Sure. So the robot itself is actually the same type of robot. If you've ever seen any of those commercials for car assembly lines where there's robots that are riveting parts to cars, it's the same kind of robot. The only difference is this part here is the actual radiation machine. So you can see that there's many different joints here that can all move, and that allows the machine and the radiation machine to come at the patient from virtually an unlimited number of angles. A standard machine just rotates around them in one plane. So if you're thinking about trying to treat somebody with cancer, as a radiation oncologist, we're always limited by how much radiation the other normal tissues can take, because obviously we don't want to cause any harm to the patient. And that's always been limited by the fact that we are limited in the degrees of angles that we can come at patients. What the CyberKnife can do is, instead of giving a very high dose of radiation from one angle, it can come at a patient from 100, 200 different small microscopic beams that converge on the tumor and obliterate it. And within a few centimeters of the treatment of the tumor itself, there's very, very little radiation. So this is an advancement that's really, it's exciting on a professional level, and it's very exciting for the patients in Ocean County.
Now, does this give new hope for patients that have, so to speak, inoperable tumors, that have cases that, surgeons don't want to have to, deal with, so to speak? I mean, does this give them new hope?
It really does. The concept of doing what's called stereotactic radiosurgery, which is this concept of delivering very high doses of radiation to a small area. It's not a new concept. The CyberKnife is not the first machine to do this, but it's the most precise. So we've been doing this for quite some time in our field, and we've always been limited by our lack of precision and our lack of ability to limit dose to the normal tissues. Patients, for instance, with lung cancer, who have a stage 1 lung cancer, the treatment for them would be surgery. But there's a lot of patients that are too sick to have surgery. They can't tolerate the anesthesia. They can't tolerate the recovery from this. And those patients typically didn't have a good secondary option for cure of their cancer. The CyberKnife is able to deliver ablative doses of radiation therapy that can kill the cancer cells without any of those problems with anesthesia, post-operative recovery. There's no cutting. It's an outpatient procedure. So, for instance, in Toms River, where we're located, we have a significant elderly population, and a lot of patients who have lung cancer, they're typically patients who have lung problems to begin with, and they often can't tolerate surgery. So this is a very good option for them. And there's a very big body of literature that has been done all over the country, and in Europe and in Japan, that's showing very high cure rates with this type of treatment.
This also seems like an alternative for people who are looking for that alternative to the conventional cancer surgery. Take me through what a patient can expect if they choose to use the CyberKnife program.
Sure. So the first part of treatment for somebody that's going to be going through this is to do a CAT scan in our department. That is the CAT scan that we use to do the planning on. So The person gets a CAT scan and they leave. We then do the planning behind the scenes where we optimize the amount of radiation that's going to the tumor, and again, this concept of limiting the dose to the surrounding normal tissue. What the CyberKnife can do is it can actually track breathing, and the head of the machine, and I'll show you how this works, as the patient's breathing, it will learn their breathing pattern, and the head of the machine will actually move with each breath. The way it accomplishes that is in the ceiling of the room. There's also imaging cameras that are constantly taking real-time images of the patient and updating the treatment to make sure that if the person moves a little bit this way, a little bit that way, that the machine moves with them. So the treatment itself, it takes about an hour to an hour and a half, depending on the body part we're treating. Prostates often take less than an hour. And basically you lay down on the table, you listen to music. We have a TV screen that's mounted on the ceiling that you can watch images go by. Most people just take a nap, and we usually find our therapists are waking them up to tell them the treatment's over, because you really don't feel anything, you don't see anything other than the machine hovering around you.
That was my next question then. So in less than an hour, people can get up and leave like you're saying. So you're saying so it's virtually pain-free then? It's
pain-free during the procedure, absolutely. There's no cutting. You don't feel anything. You don't see anything either. I always tell patients that getting treatment with radiation therapy for cancer is very similar to getting a chest x-ray. When you get a chest x-ray, you don't see anything hitting you, but you do know that you're getting an x-ray. So when you're treating cancer with x-rays, it's just a much higher energy level, but it's the same concept. And you mentioned there's no incisions involved in this treatment, so is there less of a risk of complications in this procedure? Well, anytime you take out the anesthesia and the cutting, there's always going to be risks of less side effects. That's not to say that there's not the possibility for side effects with radiation, but we tend to see that they're less because of the level of precision and accuracy of the machine. Now, will this procedure totally eradicate the tumor? I mean, what is the remission rate involved? So, we don't have enough time to talk about every single disease site, obviously, but I'll use prostate and lung as examples because there's a large body of literature for them. So if you look at the studies that have been done using stereotactic radiosurgery to treat lung cancer, the cure rates have, across the board in many studies, been greater than 80–90%, and that is in line with surgical series. So we're very excited about this. The literature is supporting it, and I think it's a very good alternative for patients that can't have surgery. If you're talking about prostate cancer, again, there's studies showing that the cure rates for the CyberKnife for men who are candidates for it is similar to standard radiation with IMRT treatment. Now, are there any types of tumors that this is not effective on? Well, obviously, you have to take patients on a case-by-case basis. In general, the CyberKnife is a tool for patients that have one tumor in a single spot or in multiple spots that can be focused on. Patients that have very large tumors with a lot of lymph nodes are not typically candidates for this. And in addition, there's a large group of patients that have, unfortunately, metastatic cancer who are undergoing chemotherapy. And there might be one or two areas that are just not responding to chemotherapy. And that would be a very good area where the CyberKnife can come in and eradicate those 1, 2, or 3 different areas that don't seem to be responding to chemotherapy. Okay, doctor, we have to take a quick commercial break, but don't go away. When we come back, we'll tell you how using the CyberKnife may reduce the number of visits a cancer patient needs. Stay with us. Thanks for staying with us here on Eye on Ocean County. I'm Christina Seco. Cancer patients now have the option of reducing their treatment times significantly when using the CyberKnife program. Joining me once again to discuss more is Dr. David D'Ambrosio, radiation oncologist and medical director of the CyberKnife program at the J. Philip Sitta Regional Center. Thanks again for being with us. How indeed does this reduce the number of treatments they will need? So let's use prostate cancer as an example. If you're getting standard radiation for prostate cancer, that involves getting a daily treatment Monday through Friday for about 9 weeks. And the limitation there is, again, this concept we were talking about earlier of using a standard machine that has to come at you from several different angles. What the CyberKnife can do, because of its ability to deliver high doses of radiation over a short amount of days, is to deliver that same effective treatment dose in only 5 treatments. So rather than coming Monday through Friday for 9 weeks, you're talking about coming 5 times over 2 weeks.
So that is a big drastic
Yes.
difference of having to get out there. Talk to us about how this machine locates the tumor, because I know you had mentioned it has precise angles, but how does it find the tumor?
Sure. So its ability to find the tumor is obviously just as important as the robot arm. So there's two sets of cameras that are in the room. Immediately in the ceiling are X-ray cameras that during the treatment will keep taking pictures of the area that we're treating. And there's 2 ways that the CyberKnife can track the tumor. In certain instances, it can track the tumor itself because it can see the density of the tumor. And in other areas, for prostate, for example, we actually have small gold seed fiducial markers that we have implanted inside the prostate. And the CyberKnife system can see those markers, and it moves with the tumor movement. A second set of cameras that are in the room are infrared cameras that monitor the patient's breathing. So we talked a little bit about lung cancer before. So obviously, somebody's going to be breathing over the course of an hour. So we need to monitor that, and we need to have the machine moving when the patient breathes. Also, cancers that are in the abdomen, right below the lungs, we're also going to move. So the CyberKnife, those second sets of cameras will enable the CyberKnife to learn the patient's breathing cycle, and it will allow us to track it and move with it.
How did the CyberKnife come about? When did they decide that they needed something like this? And how did you get trained for this? Where did you learn how to use the CyberKnife?
Sure. So I mentioned earlier that it was invented actually by a neurosurgeon in California. The concept of stereotactic radiosurgery, which we've been talking about, has been around for 60 years. What we haven't had is the ability to use this technology towards other tumors in the body. We've largely done stereotactic radiosurgery to the brain. And what that involves is, traditionally, and with systems like the Gamma Knife, which some people may have heard of, is actually screwing a frame into the skull of patients in order to enable us to get that same degree of precision that you get with the CyberKnife. What this neurosurgeon figured out was that if you use real-time imaging and you use a robot arm, you can get the same level of precision that you would get and not have to screw those frames into the patient's head. Treatment for lung cancer has been around, again, for many, many years, but when you don't have the level of precision that you have with the CyberKnife, it forces you to treat a bigger area than you normally would want to, and consequently get more normal tissue toxicity.
And you said your team has all been trained together to learn how to use this properly.
Right. So myself and my partner, Dr. Rajesh Iyer, we both went to California to get specific training on the CyberKnife, as well as our neurosurgeon, Dr. Richard Hartwell. He also went to California to be trained specifically on the CyberKnife. All of us, though, do have experience with stereotactic radiosurgery on standard machines, specifically when you're talking about lung stereotactic treatment. Myself and my partner, Dr. Iyer, we both trained at Fox Chase Cancer Center in Philadelphia, and I was involved in some of the initial studies that were done looking at stereotactic radiosurgery for lung cancer.